Democratic gubernatorial candidate Beto O'Rourke is pledging to transform the Texas Medical Board if elected. This in response to a months-long series of KXAN investigations that revealed disciplinary records kept secret. Doctors deemed a threat allowed to keep practicing, and top-dollar donors appointed by the governor to the board.
KXAN investigator Matt Grant spoke with O'Rourke and has more on his plan that could impact your safety and become a political issue in the election.
That's what stands out to me from what I have learned from your reporting is just this pay-to-play system that we knew existed in Texas. I didn't know how bad it was at the TMB, but it's something that we've got to change.
Beto O'Rourke wants more accountability and oversight of the Texas Medical Board, the state agency overseeing how doctors are licensed and disciplined.
We might not have the oversight and the accountability for our medical providers that we should be able to count on for ourselves and for our family.
The former presidential hopeful turned Democratic candidate for governor saying he would change the makeup of the 19-member board so public members meant to represent patients are equal to the number of doctors sitting on the board, something patient safety advocates tell us is needed.
If elected, would you appoint public members who come from a patient safety or patient advocacy background?
If I'm governor, we're going to make sure that the Texas Medical Board is comprised of people whose sole focus is in protecting the public health.
Our investigations found at least 7 board members on the TMB collectively donated nearly $400,000 to Governor Abbott, with public members plucked from energy, business, and real estate sectors. O'Rourke says he would not appoint people who donated to his campaign and would select public members with expertise in patient safety. He also wants to work with the legislature to do away with donor appointments for all state boards.
The last thing that we'll look at is whether someone has donated to me or not. People need to be placed in these positions on their merits. Look, at the end of the day, our responsibility in our state government is to look out for and protect the people of Texas.
In a statement, the governor's office tells us Abbott expects board members and doctors to uphold the highest standards of care and trust and will accept nothing less. They would not say why donors are appointed. His staff touted the Texas Medical Board as, quote, a national leader in transparency and discipline, sending us this investigation by the Atlanta Journal-Constitution as evidence. The problem? The report is 6 years old. It also only looked at a few focused areas, like medical board transparency when it comes to discipline records being made public for doctors specifically accused of sexual misconduct with patients. The report did not measure the overall performance of the medical board. At the Capitol, Matt Grant, KXAN investigates.
A quick note now, we gathered this interview and the governor's response before the tragic shooting in Uvalde. Members of the medical board have not responded to our request for a comment.
You can catch up on our entire series into the Texas Medical Board right now at KXAN.com. Just click on Still Practicing under the Investigative tab.